Good morning, everyone, and welcome to today's meeting of the Audit and Performance Committee of the IJB. My name is Sheila McCall. I'm the chair of the Audit and Performance Committee, and on the top table here to my right is Jackie Pepper, who's the Chief Officer of Perth Health and Social Care Partnership, and to her right is Donna Mitchell, who's the Chief Finance Officer, and to my left is Jessica Guild, who's the Clerk to the committee. Is Scott Henry online?
He's joining.
Scott Henry, Democratic Service Manager, is joining online. Can I ask Jessica to confirm any apologies received, please?
Thank you, Chair. We don't have any apologies today.
Thank you, Jessica. And can I just remind anyone who's joining us remotely to use the chat function to draw attention, either to put a Q if you want to ask a question or C if you want to make a comment or point of order or anything else you wish to do. So the chat function is there. If you don't have the chat function, if you can use the hand function or just wave and we'll pick you up. Thank you. Can I ask the clerk to confirm any updates to the Audit and Performance Committee membership?
We're joined today by Heather. No, we're not. She's not. Heather's not with us. Oh, she's okay. Thank you. So Heather joins the committee today, and we still have the vacancy for the public partner.
Okay, thank you. I'll keep an eye out for Heather and we'll welcome her to the committee at the moment, but I'll welcome her when she hopefully joins us fairly soon. Thank you. Can I ask if there are any declarations of interest in respect to today's business? No. Okay, so well, in that case, I apologise for if you didn't receive the invitation, Martin. We can ask our committee support team to have a look at that and make sure that you are on the distribution list. So I do apologise for that. Okay, we come now to the action points update. Can I invite the Chief Officer to give an update on action point 56, please?
Thank you very much. Chair, in relation to action point 56, we agreed at the meeting in November that we would provide an annual update on clinical and care governance, and that will be in hand, and the planned date is for the 25th of August. Thank you.
Sorry for a stupid question, but can you remind me what the Clinical Care Governance Forum is, please?
Thank you, Councillor Illingworth. That's our local clinical and care governance forum, which looks at professional standards, quality, risk, provision of services and escalation of concerns. That's co-chaired by the clinical director and the chief social work officer, so it has an integrated approach to that, and that then reports to NHS Tayside's Clinical Governance Committee and the Council's Scrutiny and Performance Committee, and then back to here, and there's a report later on in the agenda. So that's the role of the forum. It's set out in the integration scheme.
Thank you. I apologise for not knowing the answer. Thank you.
That's okay, Tim. Any more? I don't see any other questions. So may I ask the committee if completed action 54 can be removed? Agreed, everyone agreed to that. Thank you very much. Now we move on to the performance reports, and we're joined this morning by Jill Galloway, the Chief Officer for Angus Health and Social Care Partnership, and Lisa Prudham, the Head of Health and Care Services of Angus Health and Social Care Partnership. This report was prepared by the Chief Officer of the Angus Health and Social Care Partnership and submitted to the Angus IJB in October 2024. Subsequently, the report was due to be considered by Perth and Kinross IJB itself on the 11th of December 2024. However, due to the number of items on the IJB agenda for that meeting and that it ran over, it was not considered by the IJB as planned at that time. Therefore, a decision was taken to bring the report forward to this Audit and Performance Committee, along with a similar report for Perth and Kinross Lead Partner Services, which is next on the agenda for this meeting. So can I ask Jill Galloway, the Chief Officer for the Angus Health and Social Care Partnership, to present the report, please?
Thank you, Chair, and really delighted to be along to present our first lead partner update. This is part of a kind of overall programme of work that the three chief officers are taking forward to support the sharing of information for lead partner services and provide assurance both on performance and governance. And I'm really glad that Judith is on from audit to because this has been an outstanding thing for us for a while, following on from one of our internal audits. So I'm going to hand over to Lisa, who's going to take us through the report. Thank you.
Thank you, Jill, and thank you, Chair. So this paper provides an outline for each of the lead partner services managed by Angus, GP out of hours, continence service, speech and language therapy, forensic medical and primary care in terms of strategic coordination. As well as providing a description of each of the service areas and how they operate, the paper also outlines the current position at the time of writing, some of the challenges faced by these services and proposals for future consideration, as well as describing the future governance arrangements as well. For all of the areas, I think that they have in common challenges around workforce challenges and changes in patterns of demand, factors which I think are obviously common across NHS and social care services at the moment. The paper also outlines the financial position as well, and some of the challenges around the financial position based upon those two things. We know that demand has changed quite significantly since the pandemic, along with the general change in demographics of an elderly workforce, elderly population, and people being cared for longer in the community as well, which obviously increases the challenge upon community services, even though it's the right thing to do. Of particular challenge is the out of hours service, and you'll note the financial position there. At the time of writing the forensic female examiner issue, we have since appointed a female examiner to the service. However, that person obviously can't cover the full breadth of the service, so there is currently a short life working group looking at how we address that going forward as well. Paper also details proposals and opportunities. The other area that I should mention is the continence service and the challenges faced in the service in terms of the price of products, and there's been quite a substantial shift in the price of products over the last few years, again since the pandemic, and also in line with the cost of living crisis. The paper also outlines some future proposals as to how we will hopefully address and manage these going forward. And again, just to give a quick summary of the main issues there. Out of hours reform, there is a substantial piece of work that's commenced in terms of the out of hours service. It builds on the previous model of care and financial recovery papers, but takes the new kind of reform focused. It will be quality improvement driven, looking at the service, and that works a way to commence, and will involve all of the partner organisations, relevant stakeholders and our health and social care partnership colleagues, because obviously as a Tayside-wide service it's really important to have those viewpoints, and also there will be a substantial programme of public engagement around that as well. I think that's really everything in summary. And as I say, the paper concludes with the governance arrangements and proposals for how we will regularly update and provide assurance around these services going forward. Happy to take any questions.
Thanks, Lisa. And just to add, Chair, and as we develop those reports, they will be coming forward with a level of assurance on the reports in the future. So just to acknowledge, the report is from October last year, and we are due to provide an update to our own IJB, and obviously that will come to yourselves and Dundee in the near future. It was considered at the Dundee IJB as well, so just to give members that assurance that it has also been considered as a lead partner report by Dundee.
Thank you, Gillian and Lisa. And I do acknowledge that we're slightly behind on this. And in fact, although it's coming to this committee here, I think we'll also include it at our next IJB meeting, full IJB meeting, for information, so that all members of the IJB will see the report. Does anyone have any questions for Lisa or David?
Thank you. The total out of hours contacts NHS Tayside is now above the level it was before lockdown. What do you think are the underlying causes of that?
So we've seen a shift in demand and acuity, and what's occurring in out of hours is actually in common with what's happening across primary care and indeed other services. There has been a growth of around about 12 to 13% in primary care contacts since the pandemic. I think it reflects we do have an increasingly older population. And as I've said, I think that more care is being provided in the community. People are staying, in their own homes and being cared for closer to home as well. So some care that would have previously taken place in other sectors is now very much in community services and general practice. But we're also seeing an increase in the acuity. People are sicker, and again, I think that possibly reflects societal changes. And I think we need to be better at preventative and proactive medicine, really about keeping people healthy and people keeping themselves healthy as well. But that's really what's driving those changes. But it's common across primary care, and indeed is the national picture as well.
I think the other thing, just to bring in on that, we have a professional to professional service within out of hours as well, so that does mean that paramedics, pharmacy staff, care home staff can contact out of hours direct without having to always go through NHS 24. So the level of telephone contacts for professional advice has also increased as well, but it's all in terms of how we support individuals to seek the advice and the support from a primary care clinician or a primary care service when that is actually what they need. And if they do need that further onward referral to secondary care, we have really strong links between out of hours with both the emergency department and the flow navigation centre to support that onward transition if required.
Thank you, Gillian. David, does that answer your question? Are there any other questions for Gillian or Lisa? I have some. Well, first of all, I just actually want to say that the report is very helpful, and it's really good to see things laid out in this way. I think there's a couple of questions I have. I think there was something where they said we have an update in February 2025. Lost my place now and I'm just wondering where we are with that.
Was that in relation to out of hours, Chair?
Item 3.3 on the report.
Yeah. Yeah, so that's the out of hours. So we did take an update to the IJB back in February 2025. Lisa's outlined the approach that we're now taking to it. So the out of hours reform is superseding, excuse me, we're just going to wait on the fire alarm. Okay, apologies for that. We did take an update. So the out of hours reform is now superseding the out of hours model of care paper, and the reason that we've done that is in light of the national work that's been undertaken. Members, I'm sure, will be aware of the publication of both the reform and renewal framework, the population health framework. Also, there's national work going on around primary and community health care provision and out of hours as part of that. So we felt it would be more appropriate to wait and take forum the new out of hours reform on the back of the national publication, so that we can ensure that we are in line with that national direction of travel, which is supporting primary care in hours and out of hours. And that was supported by the IJB back in February, Chair.
Thank you very much indeed. And one other question on the speech and language therapy. It's for people over the age of 16. How does that fit in with the wider speech and language service that's offered? So
the Children's Speech and Language Service is managed through the Women and Children Health Directorate. There is a good transition service within the SLT, so that for individuals who are transitioning out with or under the 16-year-old age mark, then they are transitioned into the adult services. So I'm not sure if that's answering your question, Chair, if it is in relation to under 16s, or this is the Tayside-wide SLT service that covers Dundee, Perth and Angus.
Yes, it does. Thank you. I just want some assurance, because some, particularly people with some certain types of learning disabilities, sometimes have communication or swallow difficulties in childhood and they don't acquire it in adulthood. So it was just to make sure that transition was smooth the whole way through. Thank you. And that's all the questions I have. Mr. Black, Martin, do you have a question?
Thank you. When you say that there's specific contact with out of hours and A&E that's reducing the amount of phone calls, is that being recorded?
So there's a few things in that, Martin. So the process and the pathway that we have within out of hours is for individual professions, so Scottish paramedics, district nurses, etc. They can contact out of hours direct. That often means that they're not contacting the Flow Navigation Centre or indeed our mainly our acute medical colleagues to seek advice or support. We don't record the number of calls that could have gone to the Flow Nav or an acute specialty, if that's what you're asking, Martin.
Yeah, that's what I was asking.
Yeah, we don't record that routinely, Martin, because that is quite onerous, and at the moment the way that the IT system is set up within out of hours, it's not helpful and it's not easy to do that. So that would be a manual collection for us at the moment.
Thanks for that.
Okay, thank you. I have one final question. It's on section 7, financial implications, and it said the GP out of hours service that both Dundee and Perth and Kinross have formally asked Angus for a copy of the financial recovery plan for out of hours services. I just want to check with my colleagues, have they received that? Did everybody hear that online? Did everybody hear that online? No.
I didn't hear any responses to that, Chair, but I'm happy to come in. So the Chief Finance Officer has shared the information with his CFO colleagues, and we routinely have those discussions as part of our lead partner meeting or forum on a regular basis. I am able to confirm if the IJB members have had sight of that, and I would defer to either Donna or Jackie if they're there.
Yes, they're both here. Can I bring in Donna, please? Donna?
Hi, no, unfortunately we've not received a copy of that, and I've not received a format that I could share with the IJB.
Donna, I'll pick that up with Chief Finance Officer.
Thank you.
Okay, thank you both. I think that'd be useful to have that, and we can then schedule it accordingly. I know we're about 6 months behind with this, Julian. So again, I want to thank you for this, and I'm assuming, well, we have an update? When's the next update due to the IJB on this?
So
Food services report?
our update is due to the Angus IJB in October, and what I would ask, Chair, if it's okay if we look at this year's financial position rather than retrospective, given that this was from October last year. So we would look at it, the financial recovery from a 25-26 perspective, if that's acceptable to members.
That's acceptable to me. I did have a question on financials recovery, but I decided to defer it to later because I suspected that would be the answer I would get. So yeah, I think that's fine, and we'll make sure it's on the agenda for the IJB in the appropriate time once you've presented in October. Has anybody got any other comments they want to make on this report? Anybody online? Okay, then I'd like to bring in the Chief Officer who'd like to make a comment, please.
It's just a comment while we have Jill as Chief Officer and Angus online, and just that some of the synchronising of these reports is something that I think the three Chief Officers can work together, so that what you would have as an Audit and Performance Committee or an IJB is the composite reports coming together, or the reports coming together as a suite of documents, so that you're able to see that picture across Tayside in terms of our lead partner and hosted services. So I'm seeing Gillian nodding, so I think that's something that we can work together on in terms of timeframes. It might mean that we'll be slightly out given that we've got our June report here, but I'm sure it's something we can work through as we go forward, because I think that would be a better position to be in across the three IJBs. Thanks.
Yeah, absolutely support that, Jackie. And as you know, we're in the process of developing a lead partner framework, which will include the timetabling of lead partner reports coming to all three IJBs for assurance. So hopefully that does help.
Thank you both. I think that would be very helpful, and also not just the sequencing of it, but also maybe the format. So, you know, when we're looking at these things, we know what to expect and what order and what should be in it, what shouldn't. So I think that would be really helpful too. I don't see any other comments or questions. Then in that case, can I ask the committee if they're content with the report? Thank you. And I want to thank both of you for attending today. You don't have to stay for the rest of the meeting unless you particularly wish to do so.
Thank you.
So you're free to go. Thank you very much.
Chair. Thank you.
Thank you very much.
Okay. So now we move on to item 4.2 in the agenda, which is the lead partner services update for Perth and Kinross Health and Social Care Partnership, or IJB. And I will call upon Jackie. Jane, you're going to lead on that. Thank you, Jane.
Thank you, Chair. So very much in line with our colleagues from Angus, this report outlines the three hosted services that sit within Perth and Kinross. So the paper takes us through the services that are provided through prison healthcare, podiatry services, and our public dental provision. And I think people will be in agreement that it's a broad range of service for some of our most vulnerable individuals. The common themes are really, as you will see, the range of services that are provided, the challenges with regards to capacity, and the focus on individuals at risk of being marginalised. The paper then moves on to outline the current management and care and clinical governance arrangements to provide assurance in relation to these services. And finally, suggests that a more regular report is provided, which not only offers assurance to the IJB, but in turn provides assurance for our colleagues in the other two partnerships within Tayside. In light of the previous presentation, I will, of course, in the future take all effort to ensure that there's alignment with regards to structure and timing, as I agree that would be helpful.
Thank you, Jane. Do we have any questions on the report for Jane? Councillor Illingworth?
Oh, thank you, Chair. Are there still issues with recruitment for the prison service?
It's always a challenging area. I think many people go into the field and then get concerned whether or not it's the area for them. Although we do have some vacancies in the prison, we also have a number of interviews taking place. So the issue that we have should be sorted within a fairly short time frame.
Thank you.
Wait, any other questions for Jane on this report? Anybody online? Any comments or questions online? I don't see anything. So in that case, can we agree the recommendations in the report, please? Thank you. Thumbs up from Martin. That's always good. Thank you, Martin. So now we move on to item 5 on the agenda, and it's the governance and assurance section. And we have the partnership improvement plan. So can I ask Phil Gerard, our governance and risk coordinator, to present the report, please?
Thank you, Chair. The report presented to members today sets out the progress of the actions contained in our partnership improvement plan. So since we last brought it here to the committee in February 2025, 14 improvement actions have been completed. Following today's meeting, these will be archived. Position of our plan is shown at Appendix 1 to the report today at page 43 of the set of papers. As you see, the PIP, the Partnership Improvement Plan, is looking very blue, and I can remind members that blue signifies a completed action. We now only have one action remaining in the plan, and this one action is at a green status. It's scheduled for completion by December this year. We don't anticipate any issues in meeting this deadline. And just for a bit of context, at the same point in time last year, at Audit Committee, when we brought the plan, then we had 20 outstanding actions in the Partnership Improvement Plan. So we have made significant progress on the actions during 24-25. There will be more actions incorporated into the Partnership Improvement Plan soon though, pending on approval of our annual governance statement later on the agenda today, and the internal audit recommendations from the reports also being considered at today's meeting. In addition to that, we have completed all 11 improvement actions from the best value self-assessment. We've attached the final action plan from that at Appendix 2 of today's report. We have taken 2 of these actions which have been marked as complete in the best value plan, and they've led to 2 new actions. They're included in the annual governance statement and the proposed governance improvement actions for 25-26. That will ensure continued scrutiny on progress can be provided by this committee. These will go into the Partnership Improvement Plan upon approval of the AGS, hopefully on later today at this meeting. We'll continue to provide regular updates on the Partnership Improvement Plan back to this committee. Happy to take any questions. Thank you very much.
Thank you, Phil. Do we have any questions, Martin?
Thank you very much. It's actually on the outstanding action, and I see that internal audit is going to look at that in December 2025.
Yes, perhaps my Chief Internal Auditor will be able to provide a bit further information on that for me.
Okay.
So this is about sustainability of commissioned service providers audit.
Thank you for your question. I'm just looking at that now. Apologies, I'm just back from leave, so I was really conscious of my own papers that were coming to this committee rather than this particular one. So I'm just having a quick look through now. What this is an action that's been outstanding from the audit report that has previously been considered here, and as part of a wider review of some areas that are now taken forward as part of the assessment and charging team within Perth and Kinross Council. Due to various activity that's gone on within that team, that's been delayed until December for them to be able to provide us with a full update. So I will be requesting that information from them in December as part of a more extended review of some areas of activity. But that is something which is on our work agenda for later this year.
Thanks, Jackie. Does that answer your question, Martin, or do you have a supplementary? Or a different question even?
It answers the question, but what actions are actually being taken? Because it looks like the service providers are not playing ball here.
It's my understanding that the service is working with the individual service providers, that the assessment and charging team is in communication with them. This is really around about having a complete view of all activity that will be provided to me by December. But as far as I'm aware, you know, what we've got within the gift of our staff is to try and contact and to work alongside the service providers. And as I understand it, there's action is being taken and has been taken and will continue to be taken in that regard. But I'll be able to provide a full update to this committee on following that. Thank you.
Thank you.
Thank you, Jackie. And David?
Thank you. It's great to see so many of these actions actually gone to blue and only one at green. My slight concern is that you end up having so much success, you end up resting on your laurels. Are there any other challenges that we can deal with in the future?
Thank you, David. Who wants to take that, Donna? Who wants to take what? You're queuing up to answer that question. So, Phil will take Phil first because I think you referenced what's coming along.
Yeah, we continually look for ways to improve internal controls and governance arrangements. You'll see later on the agenda, we have the annual governance statement. We've identified 9 actions, I believe, that we believe will improve our internal controls over the coming year.
Thanks, Phil. Does that help, David? Donna or Jackie, do you have anything else to add?
Just to say that I absolutely concur with that, and there will be a number of things that we'll be adding on to that as well as we go forward from our continuous improvement journey. So it's not a done deal and a completed job. It's actually a constantly evolving picture here that we're presenting. So I think if we, I suppose, hope that gives the reassurance around that.
Thank you, Phil and Jackie, for that. I don't see any other questions or comments, so can we agree the recommendations in this report, please? Thank you very much indeed. Now we move on to Jackie, to the Internal Audit Progress Report, and can I ask Jackie to present the report, please? Thank you, Jackie.
Thank you, Chair. This report highlights that there's been significant progress made with completion of internal audit plans, and as is highlighted later on in the report, in the meeting, sorry, there's 3 internal audit reports which are presented along with the annual report. The final audit, which is yet to be fully commenced, is a cross-Tayside piece of work on lead partner arrangements, and that's currently in the planning stage. So I would anticipate that will be undertaken within the coming months. But I'm happy to take any questions or comments on this progress report.
Thank you, Jackie. Martin?
On the 2203P, it's about the premises and property being limited assurance. But what plan is involved in taking that out? I struggle with limit assurance. And what is limit assurance? Is it working? Is it not working?
Thanks for the question. I'll be coming on to talk about each of the individual reports very shortly. This is really kind of just a summary report at this point for noting, and then we'll move on to more of the substance, if that's okay.
Thank you, Jackie. Any other questions? Okay, well, in that case, can we agree the recommendations in this particular report? Thank you. I should also say at this, so before we move on to the next item, I should say that we welcome Mary O'Connor from the External Auditors, Audit Scotland. Yes, to the meeting. She's here as an observer, so welcome, Mary. I'm happy to take any feedback afterwards if you think it's appropriate. And we also have Judith Trebes, the Principal Auditor, and Anne-Marie Mackin, Regional Audit Manager of NHS 5, to assist in answering questions as we go forward. They undertake some of these audits on our behalf. Okay, thank you. So item 5.3, Jackie, can I ask you to introduce the report, please?
Thank you. This is the audit report that on premises and property, which was undertaken by colleagues in the NHS. As has been mentioned, Anne-Marie Machin and Judith Trebes are here, who undertook the work and the quality assurance process from an internal audit perspective. As has been highlighted, this area has been assessed as having limited assurance over the internal controls, risk management and governance around the management of the property and premises risks. There are 3 significant findings arising from this and 2 moderately rated findings arising from this. As I said, Anne-Marie and Judith have undertaken this work, so they're here to answer any detailed questions on that that anybody in the committee may have. Thank you.
Thank you, Jackie. Does anyone, Martin, do you have your question now in this report? You said unlimited assurance.
Weakness in the design or implementation requires action. So what actions are actually in place?
Thank you, Mark.
To start with, what I would say is that the action plans which are attached to all of the internal audit reports are the actions that have been agreed with management to address the risks and the issues that have been raised during the report. These actions that are agreed will address the limited assurance that we are currently able to provide as internal auditors, and to raise that to reasonable and hopefully substantial assurance over time. But I'm happy to hand over to Anne-Marie or to Judith if they want to add anything else.
I think it would be helpful to hear from both of you, or one of you at least, on this particular audit report, because I agree with Martin. It's very concerning that it's a limited assurance. And from my own knowledge from the Perth and Kinross Council perspective, that doesn't seem to reflect, some of the findings in here doesn't seem to reflect the reality of what's happening. So I think it would be quite useful to maybe give us some insight into how you reach the limited assurance status, please.
Yeah, Chair, I can cover that off. So as you would have seen in terms of the introductory sections within the report, this audit was undertaken related to the then long-standing Priority 1 Strategic Risk 14 around partnership premises. And as noted in the report, this remained the case within the June 2024 Strategic Risk Register for the IJB. We commenced this audit fieldwork in August 2024, and this included a review of documentation and meetings with relevant officers, with the work focused on the controls stated to mitigate Strategic Risk 14, including the articulation of premises needs and the governance arrangements for asset management. From the work undertaken at that time, we did arrive at a limited assurance opinion, and this was based on the level of understanding of the current and future premises needs linked to the IJB, not having direct control over premises, and there being no clearly articulated, mutually agreed and understood process in place to ensure that the needs of the IJB were factored into capital planning decision-making mechanisms by the partners. The other sort of a key factor for us in reaching that limited assurance opinion was that whilst there was evidence of informal working relationships resolving individual property requirements and achieving successful outcomes, that does mean that there's a risk that as staff and organisational context change, informal arrangements such as these can break down, which could have a negative impact on service delivery. So when we undertook that work, we did feel quite strongly that limited assurance was the appropriate audit opinion to be reached at that point in time. Within the report, we have noted more recent updates that we were provided by the Chief Officer, and that update captured that there had been progress since the issue of the draft report in November around the HSEP property arrangements, and that things were working better from a Perth and Kinross Council perspective. And also that more recent update from the Chief Officer advised that the premises risk had been reviewed and it was no longer a strategic risk within the IJB risk register. So at the time that we undertook that work, we did feel that limited assurance was appropriate given the informal nature of arrangements and the needs not being clearly understood at that point in time.
Can I bring in the Chief Officer, please, Jackie Pepper?
Thank you very much, and really for members' awareness, the actions that were set out in this report have been taken forward. Particularly, I think this is an area where our engagement with our partners is really key, because we don't operate premises and we don't have a capital programme ourselves. The premises risk that has been outlined previously and reported to the Audit and Performance Committee was very specific to key areas, which, as has been set out, have been addressed with a variety of moves within Perth City in particular, and our engagement in the Working Smarter programme within Perth and Kinross Council is very much at a formal and strategic level, with Jane Menzies, who's here today as the key contact within the Health and Social Care Partnership, to ensure that our needs are addressed in the Working Smarter programme, which has most recently focused on Puller House and is about to come to a conclusion after the summer, in which we have ensured that our property needs are addressed and in fact are strengthened with a greater presence within Puller House, co-location of certain teams that are not currently co-located. So there's great progress there. And our engagement with the asset management group within NHS Tayside, I've taken that on as a responsibility myself, so the actions are being taken forward. And the refreshed risk register for 25-26 no longer has premises as a strategic risk. But what we will do is, with the new strategic plan for the IJB, and it's set out in this document, there will be a strategic delivery plan progressed for both primary care, older people service, the three key areas, which is older people, adult services and primary care, and arising from that, any strategic changes and requirements, property requirements we have will be fed into the processes that we're engaged in. Thank you.
Thank you, Jackie. And thank you for your, I can't see the screen very well who replied to that, but thank you. I suppose the question I have, and particularly because this has been something that's been promoted very heavily by Perth and Kinross Council in terms of one public estate, is whether or not this same findings would have been applied to the Perth and Kinross internal audit and perhaps NHS Tayside internal audit, because there's no point just bringing it here where the Health and Social Care Partnership do not own or operate premises. The responsibility to some extent must reside with the partner organisations who do. So if these findings are presented here, are they also being presented to the relevant partner organisations for audit and performance?
From the
Chair,
oh,
sorry, Jackie, on you go.
From the Perth and Kinross Council point of view, it hasn't been presented, but it certainly can be presented to the Audit and Risk Committee.
Chair, I can answer. It's Anne-Marie from FTF. We are also the auditors for NHS Tayside, and as part of our routine monitoring, once an IJB audit report has been considered by the relevant IJB Audit Committee, we then provide a summary of that report within our overarching NHS Tayside internal audit report. So the Audit Committee will be advised of the findings from this report.
Thank you. I think that will be really helpful for both. The action point 3, the pan-Tayside arrangements. The thing is, I actually feel from a Perth and Kinross perspective, certainly, that it's almost become business as usual, that we have ongoing dialogue, and so I'm not convinced that a separate forum is necessary. That's perhaps sits outside the day-to-day working operations. Not just from an overarching strategic property management, but also from operational management, etc. So I think there's maybe an action here, Jackie, to be taken, Jackie Pepper that is, or maybe both Jackies, to be taken away and to maybe review what the current arrangements are, and maybe come back to this committee and maybe give us some sort of process map to give us some assurance that that in fact we don't need it, whether or not we need a separate forum, or whether or not we need to re-emphasise or make more visible the operational practices that are going on currently to ensure that we are meeting the recommendations that are in this report. Martin, you raised the issue of limited assurance. Does that help you accept or understand why they've brought forward limited assurance on this report?
Yeah, thanks for all the clarification on that, and also setting audit and risk committee, and then it should Tayside, so I'll be looking for it coming through.
Be relying on you, Martin. I used to sit in that same committee myself, but no longer, and I don't sit in the one in Perth either. So, but I think it might be worthwhile, this particular recommendation, maybe getting some sort of progress report on where we are in due course, because I think it's quite an important thing. And certainly here locally, Jackie mentioned Pillar House. There's significant integration with the public estate here in Perth and Kinross and NHS Tayside. So I'd be disappointed if people perceive this as not being functioning and not working well. That's not to say there's not more that can be done. There's a lot more that can be done, and we're continually exploring what other options are available, particularly through the more rural facilities where perhaps council properties could be made available to the NHS Tayside for its services. So there's ongoing dialogue all the time. So I feel the limited assurance is perhaps it needs to be quantified, it needs to be understood within the context of the timing of this report. Would that be a fair comment?
Yes, it would be a fair comment, Chair. It was reflective of the time when this audit work was undertaken, and reflecting the risk that was in place for the majority of 2024 around premises. In terms of the management responses provided, we were content with them, and if those actions are implemented in full, on the face of it, we would potentially assess this as a reasonable assurance report.
Thank you. And are you able to do that now, or does that require a further look again at a further point?
That would require for the action point to be followed up in terms of the audit follow-up process within Jackie's team to be able to validate whether the actions have been implemented as noted.
I think that would be really helpful, Jackie. Are you able to agree to that, Jackie?
Yes, yeah, I can agree to that, yeah.
That's lovely, Jackie. Thank you. Then I look forward to seeing this coming back in due course to this committee. Mr. Black?
Just I struggle with the word limit all the time. Like, I'm a grumpy old man.
I shall not comment on that. It's a Monday morning. Everybody's a bit grumpy. No, but I think it's quite right to question it, because that shows, for me anyway, it shows significant weaknesses or causes for concern. And as I said already, certainly here locally, I don't see that on the ground. And certainly attending NHS board meetings, as Martin would know, you know, Mr. Curley is always very clear that he's engaging with the relative property services managers throughout Tayside. So I think it'd be very helpful to have that come back, and maybe if you can speak with the officers, you can let us know when you'll be able to do that, Jackie. That would be great. Thank you. And also make sure it goes to our audit and performance or the audit and risk committee for council. Are there any other questions? Yeah.
Two questions, if you don't mind. It's to the auditors. Are you comfortable with what Mrs. Pepper has said, or do you think the one public estate initiative should be restarted?
We were comfortable with the management responses that were provided by the chief officer. I do think it is really the chief officer is closer to this and more involved in the sort of a direct working relationship. So we don't necessarily think that specific forum should be re-established, but it's making sure that an appropriate forum is in place to allow the IJB to explain and address its premises needs in a sort of a proactive basis.
Thank you. Can I bring Mrs. Pepper in as well, please?
Thank you very much. I think in terms of the One Public Estate Forum, that was led by the previous Executive Director for Housing and Communities, and I suppose the structure within the council has changed, and I think there's recognition of the chief officer's role that I'm sitting here today with as a director of the council, so therefore engaged in discussions around the capital programme and our needs and requirements within that. So it's wearing those different hats, and currently the focus is very much on the working smarter work, but there's also been a whole range of activity on a local basis and a locality basis. For example, in Pitlochry, looking at how can we consolidate public service buildings across partners beyond NHS and the council, so it would include police, etc. And from that, there has been a change in terms of how property is used and accessed by a whole range of services. So I suppose really what I'm saying is here that wearing that director hat at the chief executive's team for NHS Tayside and within the council, I'm able to influence that at that level too.
Thank you. And I think that's the point I was trying to make earlier, David, that although the forum itself didn't exist, to me it was almost like a startup function, and then it morphed into almost business as usual with the right people attending and you know, contributing to the strategy going forward.
Okay. The second question is again to the auditors. Are you comfortable that given the actions that have been agreed, if you were to do the audit again, it would get a higher result than limited?
Yes, I think, I mean, again, as I sort of mentioned slightly earlier on, I mean, there would need to be a sort of a proper audit follow-up undertaken, but based on the management responses provided, we were content that that would improve the situation, and that now on the face of it, it would now allow us to have reached a reasonable opinion in terms of the overall conclusion on the audit. But again, that's a very high level observation without actually having access to detailed information.
Thank you, Anne-Marie. I think, David, we've already agreed previously in this report that we will get further review of the limited assurance status, and hopefully it will be able to be evidenced to be more reasonable assurance or better. Okay, is that all your questions? Thank you, David. I see no other questions on this particular report, so I want to thank Anne-Marie and Judith. I was calling you Lisa earlier on, I do apologise. Don't know where Lisa came from, but I want to thank both of you for attending today and for answering our questions. It was really helpful to have you here, so it was very much appreciated. And can we now agree the recommendations in the report? Thank you very much, everyone. Thank you, Anne-Marie and Judith. We now move on to item 5.4. Can I ask Jackie Clark to introduce the report, please?
Thank you, Chair. This is the report on the outcomes from the internal audit review of the joint equipment loan store, which is referred to as GELS throughout the report. GELS provides the fitting and collection service, supplying equipment to meet the assessed needs of service users with physical disabilities and acute and chronic illness throughout Perth and Kinross. GELS engages with stakeholders who request equipment for GELS to then deliver or provide as appropriate. The audit concentrated on 3 control objectives to ensure that the equipment is delivered in a usable condition and according to the timescales, to ensure that the management and monitoring of planned equipment and breakdown repairs for the equipment, and also to ensure there's a comprehensive and robust system for handling complaints appropriately. Overall, the assessment is that reasonable assurance is in place. There are a number of actions which are of medium importance, which have been identified and are included within the action plan. I'm happy to take any questions. So I think the report should be relatively straightforward with the actions that are included in this report. What I would note is that following this meeting, then I will update a report for our Audit and Risk Committee, because I think that this is also a report that would be of interest for the Council's Audit and Risk Committee as to where it organisationally sits. But I'm happy to take any questions on this one. Thank you.
Thank you, Jackie. Do we have any questions? Mark?
Thanks for the report. It's on page 80 of 188, and it's about the £1 million a year from the refurbishment. What is that £1 million based against the actual equipment that goes out, the value of the equipment that goes out, then coming back in to be refurbished? Like, are you putting 5 million out to get £1 million back? Okay.
This the figures that were included within this report were really to provide a bit of context for you as members of this committee, rather than to delve into the sort of the detail as to whether it was appropriate or not. They were just the information there was just really to give a bit of context. There's a within the scope there's some areas that we've not necessarily looked at. When it comes to the equipment that goes out, we're the professionals are assessing the needs of individual clients, and it's not for GELS to question that need. It is purely for them to actually deliver what is required. So the figures that were there that you're talking about that are part of the background and information are really there for information as much as anything else.
Thank you, Jackie. I've got others lining up here to respond, so I'll come to Donna first.
Not so much as a response, but just to give it a bit of context. So we were just checking there, the recurring budget within GELS for equipment is around 450,000. So it's just for you to give that figure in context of that. So about 450,000 per year is the budget for equipment. Although in 24-25, we did spend closer to 600,000. We accelerated capital funds in order to meet that in 24-25. It's just to give that context.
Thank you, Donna. And
Thank you. We can get the detail to you, Martin, separate to this, if that's something that you're interested in. No, yeah, but I suppose what this is saying is that work to refurbish equipment is saving us £1 million per year, and that's the key message from this report.
Can you tell me, give me some examples of the sort of equipment that's loaned out?
David, this is really an audit report, so I'm not sure if Jackie is the right person to do that at this particular point in time, but it is a service, an operational service that's of great interest, and I don't know David, but we do often get casework around that. So it's maybe something we can look at separately to look at how that works and how it's serviced, if that's okay.
It's just to say we could give you that level of detail, but I wonder if in terms of understanding how this service works and understanding the importance of it and its central purpose and contribution to keeping people safe at home for longer. I wonder if a development session or a visit to the centre would be more appropriate for wider IJB members as well.
It's kind of what I was thinking, that I think it's very useful, particularly for for all IJB members who aren't involved in a day-to-day operational basis, to understand this a bit more. And I think your question is very valid, David. I just don't think it's a question for Jackie Clark, because it's more to do with operational issues rather than necessarily our audit work, if that's okay. So I think we'll take forward that in future. I mean, I'm also particularly interested in the financial viability of it, particularly since we no longer charge for deliveries. And also I'd like to see the success of returns and the ratio of those to output. So there's quite a lot of areas that I'd be particularly interested in, well, but I realise that's out with the scope of the audit that Jackie carried out, because the parameters, I'm not sure what they are actually. So is that okay, David, if we do it at another point? Okay, any other questions or comments? Thank you very much. And now we go on to you finished now, Jackie? Yes. Oh, yes, it is. So I call again upon Jackie Clark to introduce the next report, please. Thank you.
Thank you, Chair. The next report is arising from the internal audit of the risk maturity, which has been undertaken by the Perth and Kinross Council team. This followed up a report that was undertaken by our colleagues in NHS Tayside back a few years ago on risk management, and we've moved on from looking at risk management into an area of risk maturity as to how mature the organisation is in assessing and managing its risks. You'll see that from the assessment of the control environment that reasonable assurance can be placed on the arrangements that are in place. And I'd note that the second control objective, which is around risk maturity development and progress, that no actions have arisen from that and that substantial assurance can be placed in terms of maturity. There are a number of moderate and less actions which are included within the report, and particularly on this one, with Phil being present at the meeting, I'd like to very much thank Phil for his support with this report and the timeliness of this report. I'm really quite content with the actions that are included, some of which are already complete as well. I'm happy to take any questions on this. Thank you.
Thank you, Jackie. Anybody got any questions in this report? I don't see any questions, and I don't see anything online. Something in the chat. Hold on a second. That's just something from Jessica. So I don't see any questions or comments in this report. So can we note the report, please? Thank you. Now we move on to item 5.4. I was way ahead of myself there, and it's the internal audit annual report, please. And Jackie, I think you're on the floor again.
Thank you. Yes, I believe this should be my last report here at this meeting. The public sector internal audit standards, which I've previously highlighted to this committee, came to an end at the end of March, but were in place for the whole of 2024-25. That requires that an annual report and opinion is provided to those charged with governance. In this case, for the IJB, it is for the Audit and Performance Committee. This report fulfills that requirement. It sets out the work that's been undertaken by the internal audit, both within the council and also with our colleagues in NHS within the year, and highlights that reasonable reliance can be placed on the risk management, governance and internal control systems that have been in place for 2024-25. And that's the key message from this report, is that reasonable reliance can be placed, which is audit speak for that's we're in a good place. Section 2 summarises the report that's been undertaken, the work that's been undertaken and has been considered within this committee before, and it also references the adequacy of the scrutiny arrangements in place for following up agreed actions. I'm happy to take any questions on this, but really I would ask that you would note that my opinion as Chief Internal Auditor is that reasonable reliance can be placed on the IJB's risk management and governance arrangements and the systems of internal control for 24-25.
Thank you, Jackie. Have we got any questions or comments on the report, please? Don't see any questions online either. Excuse me. So if we're happy with that, can we note the report? Thank you very much for attending and answering everyone's questions. It's very much appreciated. So now we move on to item 6 on the agenda, which is the draft annual accounts. And can I ask annual governance statement? My apologies. Can I ask Phil to move ahead with the introduce this, please?
Okay. The annual governance statement is included as a separate agenda item for separate approval by the committee today as normal. Once approved, it will be inserted into the draft annual accounts themselves. A reminder that the annual governance statement is a document that provides the committee with a report on the IJB's governance and internal control effectiveness over the past year, and we outline any issues that we identify and our plans for improvement in the coming year. So to inform this annual governance statement, we have conducted a thorough review of the IJB's governance and internal control systems that were in place over the year. We acknowledge some areas for ongoing improvement, but we are confident that the internal control systems in place are robust, adequate and effective. Key features of the governance arrangements that were in place during 24-25, summarised in sections within the AGS. These sections broadly represent the principles of good governance as set out by SITFA in their Delivering Good Governance and Local Government Guidance, and it also reflects our PIP report that we considered earlier with the sections included in that. The key achievements over the year are set out in the grey boxes in each of these sections. Some of these include we implemented a new senior leadership structure, and that contributed to mitigating strategic risk. We approved a new plan, a new strategic plan for 24 to 2027, and that was shaped by extensive community consultation. We also enhanced stakeholder engagement through the rollout of Care Opinion, which captured 400 user stories, including a UK first from prison healthcare users. The 2022 to 25 workforce plan has concluded successfully. The new plan for 2025-28 is now in development. We've also, over the year, we have completed all 7 governance improvement actions that we identified at this point last year in the previous AGS. And for this coming year, 2025 to 2026, we've identified a clear action plan to continue strengthening IJB's governance. And as I mentioned earlier, we've identified 9 areas from our work throughout the year where we believe we can improve on our governance arrangements. These are all detailed on page 130 in the set of papers today in the action plan moving forward. So upon approval of the annual governance statement, these improvement actions will form new actions in the partnership improvement plan. Progress will continue to be scrutinised and monitored by the senior management team and this committee as we move throughout the year. Happy to take any questions. Thank you.
Thank you, Phil. Do it, Martin.
No question, it's just an observation. I think this plan was excellent, the way it was presented, and the review, the ongoing work that's been undertaken, I found that very helpful.
Thank you, Martin. David?
Again, it's a comment, and section 4 talks about organisational development, and comments on the development session, just like to say how well they're run. And the visits that IJB members also included a visit to a care home in Crieff and also to Perth Prison, were both very interesting. So thank you.
Thank you, David. I don't see any other questions or comments coming forward, so can we agree the recommendation in the report, please? Thank you, everyone. So we now move on to item 6.2, which is the unaudited annual accounts. So can I ask Donna Mitchell to introduce the report, please?
Thank you, Chair, and good morning, everyone. Before introducing the annual accounts, I would like to thank the teams and the people that have been involved in ensuring that we have a set of unaudited annual accounts to present to you today. Just on the theme of many thanks to Phil Gerard on his work all year on the IJB's governance. The production of the annual governance statement is very much an all year and an ongoing task, and Phil's done an excellent job to ensure that we have a robust, comprehensive and clear programme of work to produce that statement that's been with you today. I'd also like to thank the senior and service management teams and their work with Chris Jolly to ensure that we have a management commentary within the accounts that reflects the key work for this year. For the statements and the accounts themselves, I would like to take this opportunity to thank the Health and Social Care Finance team led by Mark Grant. It has been a particularly, as you'll all be aware, challenging and difficult financial year, and the team have worked tirelessly to maintain strong financial stewardship. But this has been done whilst recognising the importance of understanding our services and working closely with them. As a people-focused organisation, there are times when service needs must take priority, and I'm grateful for the finance team's commitment to supporting those decisions in a way that balances financial responsibility with the realities of delivering vital services. And this is no small task, and I would like to recognise and acknowledge their commitment and the way that they balance the need to understand and respond to service requirements in this difficult financial climate. Mark and I would like to thank both Callum Alsmeyer and Chris Robett, who as the senior accountants have led the team through this year, which culminating in the successful production of the accounts before you today. The unaudited accounts consist of a management commentary, which provides context on our financial performance, strategic risks, priorities, and to inform how we are delivering on our objectives. The annual governance statement, as Phil's just pointed out, sets out how we ensure good governance, manage risks and maintain internal controls. And finally, the financial statements themselves present the detailed financial position and results for the year, prepared in line with the accounting standards and the statutory requirements. The financial position has been reported throughout the year, and IJB members were presented with the final outturn report at the IJB meeting earlier this month, and this position is represented within the accounts today. If the committee authorises me to sign the unaudited accounts today, they will be submitted to Audit Scotland to commence the external audit, and they will be made available for public inspection. So I'd be happy to answer any questions members may have.
Thank you, Donna. And I'd also like to echo and I'm very impressed by the hard work and the effort gone into preparing these accounts for this time. I know it's not an easy feat at all. I've been through many of these in other organisations, so I think it's very, very commendable that you've managed to do this in this timeline. I think it's also, to echo what Martin Black said earlier on about the governance statement, that it's very clearly laid out. It's very easy to see. There's nothing in here that would be a surprise, to be honest. And I think that's a lot of that also goes down to the hard work that's done to keep all board members, full IJB, in terms of development sessions and keeping everyone up to date with the progress of the financial model that we have for our IJB. So my thanks wholeheartedly to Donna, Mark, and the entire team, in fact. Thank you. So do we have any questions or comments on the report, please? David?
Thank you, Chair. Again, I'd like to agree that these are very, very well set out reports. It's working hard is one thing, but delivering great results is even more important. So thank you very much for those. The question is down to the note on expenditure and income analysis by nature. The gross expenditure has gone up from 297 million to 316 million, which is about 6%. Could I get a brief commentary on why it's gone up and what's been done to reduce that?
What page is that on? Donna?
Thank you, and thank you for the comment. Question. I would say that much what's included within the increase in expenditure from last year to this year will include things like the increase in the living wage and the cost to pay that, the increase in salary costs and the pay uplifts. It will also include the increase in care related activity that we've been reporting on throughout the year. And it probably they're the main, if we were to break down the material movements, it probably would be the three things that would stick out the highest.
Thank you. Is that okay, David? Yeah. I think Jack Pepper would like to add something as well.
I think in terms of giving the overall context of that, the chart on page 4 of this report, but 140 of the document pack, shows the population profile changes over a 10-year period, and we're probably in year 7 of that. So that shift in terms of that higher, the higher age profile or the aging profile of our population. I know we've discussed that in many occasions, whether informally in development sessions or at the formal IJB meetings. But one of the things that we want to do is actually really be able to quantify that in financial terms and bring that forward as early as we possibly can in terms of the next 3-year planning for finances.
Thank you. Martin?
I didn't have a question. Now I have a question. Page 29 or 164, 165 of 188 is under the indemnity insurance. And obviously IJB, if they provide direction to a council or NHS Tayside, could that indemnity insurance come back to hit the IJB? Because you're providing direction. I'm not clear on that. I know that NHS Tayside has that, whatever you call it, onerous. But if somebody's providing a direction, they're giving an instruction to somebody to undertake something. And if it goes wrong, where does the blame lie?
Thanks, Martin. I think Jackie Pepper's going to come back on that.
Thank you very much. I suppose it depends. I suppose it depends on the area of concern that you're raising, and we'd probably need to take some legal advice on that. But if it's about the provision of direct services, that's back to the statutory partners who still hold the statutory responsibility for delivery of those services. So, for example, if it's a complaint or a concern or legal action in relation to the quality or failure to deliver on those services, then I think it's back to the statutory partners for delivery. But we'll take legal advice on that and come back to you.
Worth taking legal advice, I think, or there's something that could kick back on that.
Thanks, Martin. I don't see any other questions or comments, so can we agree to the recommendations in the report? Thank you very much indeed. We now come to item 7, clinical and care governance section. And can I ask Aaron Singh, the strategic lead for children, families and justice, to present the report? It's a long job title, Aaron.
Thank you, Chair. The report before committee today is for the period of the 1st of January 2025 to the 31st of March 2025. Section 2.2 of the report notes the role of the Care and Professional Governance Forum in providing assurance both to the Council and to NHS, as well as to the IJB as well. It looks at the domains both within clinical and care governance and also the health and social care standards, and there are monthly reports to the forum. There is also the opportunity for escalation of any risks which might relate to safe care or issues around adult protection and or complaints. The report also notes that the forum also reports to the NHS Tayside Care Governance Committee and also to Perth and Kinross's Scrutiny and Performance Committee as well. Section 3 of the report notes the 5 domains which provide reassurance to the IJB around safe delivery of services and ensuring that there are mechanisms in place for continuous improvement of services as well. In terms of assessment for committee today, it was noted that reports were provided both to the NHS board and also to committee at council as noted, and there were no points of escalation or exemptions within that period. There are 2 appendices associated with the report which notes the reports that were submitted to those committees as well. Happy to take any questions, Chair.
Thank you, Aaron. Is there anyone, Martin or David, got any questions for Aaron? David? No. No. Thank you very much.